One of the biggest and the main factors of an athletic trainer is to make sure the potential of risk is as low as possible for the athletes. Now, there are a multitude of factors for that. The one is environment surrounding the athlete, the other is the physical condition of the athlete, and the other is the skill level of the athlete. A pre-participation physical examination is one of the first and most important injury preventive measures that you can take.
Physical examination? Yeah!
Physical and environmental conditions are something an athletic trainer should be aware about. These can include checking equipment, scanning the practice and playing areas for risks, and working with coaches to make sure it is being run as safely as possible. You should also be aware of extreme environmental conditions.
Go. Athletic trainers are usually the first to intervene when an injury has occurred to an individual. They have a series of evaluations, such as primary and secondary surveys, that they conduct. These surveys are used by physician and other sports medicine personnel to help treat the patient. Primary survey deals with the A, B, and C's, which are airway, breathing, and circulation. If the patient is unconscious, they are observed more carefully. Following primary survey, the secondary survey is used to see which course of action should be taken for the injured individual. For secondary survey, we ask when, how, and where the injury has occurred in the patient. Athletic trainers can also palpate the individual to see where they have the most discomfort. Discolorations and disformities are also observed.
Athletic trainers are the most common health care professionals to treat acute injury. They respond to common or life-threatening injuries. Treatment can be done by using rest, ice, compression, and elevation.
If the athlete is injured, it requires a course of action by the trainer. For example, if the injury is mild, the trainer can release the athlete back into activity. Example 2. If the injury is mild to severe, the athlete is taken out of activity and usually referred to a physician. And third example is, in the case that the injury is severe, EMS is activated and transported to the nearest facility. After a trainer completes an injury evaluation, they are required to write detailed records. These are recorded for later use by medical personnel performing further evaluations. The common method used to record injuries is the acronym SOAP: Subject, Objective, Assessment, and Plan.
Pain, swelling, and decreased range of motion are immediate effects of an acute injury. Following injury, there is usually a period of inactivity that can lead to atrophy, as well as decreased muscular strength, endurance, and neuromuscular coordination. Muscular strength and function decreases as the number of days of inactivity increases. To prevent this loss of function, an individual should follow a systematic rehabilitation program that includes passive and active exercises, as well as aerobic and resistance exercises.
Physiological movements are those normally ascribed to the joints, such as flexion and extension. Accessory movements are small movements that are used to reposition the bone for normal physiological function, such as supination and pronation of the wrist.
Many athletic trainers work in a position of autonomy. This requires athletic trainers to be responsible for a variety of issues related to the organization of the athletic training program. It is important for athletic trainers to be responsive to these issues so that the best care can be provided to athletes.